This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Welcome to today's Ministry of Health virtual media conference on COVID-19. I'm pleased to be here with today's expert panel who will deliver an update on the Ministry's COVID-19 response. Here to provide the latest COVID-19 updates and answer your questions are Dr. Roshan Parasram, Chief Medical Officer, and Dr. Avery Hines, Technical Director of the Epidemiological Division, both of the Ministry of Health. And we also have with us Dr. Lisa Indar joining us again. She is the Director of Surveillance, Disease Prevention and Control Division at the Caribbean Public Health Agency, otherwise known as CARPHA. I'm Candice Alcantara, Manager Corporate Communication at the Ministry, your moderator for this morning's media conference. We go straight into the presentation from the Chief Medical Officer, who will give us the clinical update and some additional information on the national status of the COVID-19 response.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to Dr. Hines, Dr. Indar, members of the media, members of the viewing and listening public. So I'll begin with the clinical update. As of March 9, 2021, 4 p.m., we had just crossed 100,000 in terms of tests done so far in both the private and public sector, leaving us with 100,809 tests. Within the last 24 hours, we had no new positives reported, leaving our total positive cases at 7,736 since March 12, 2020 to present. Our total recovered patients are now 7,508, active cases 88, deaths at 140, and total patients in hospital are now at 10. In our step-down facility, there are 5 persons, quarantine sites 339, total persons in home isolation 73. With regards to our hospitals, in the Couva Hospital and Multi-Training Facility, there are 6 persons, no one in ICU, no one in HDU at this time. At the Scarborough General Hospital at Fort King George, there are 4 persons. So I spoke to Dr. Hoyt this morning, and hopefully those persons should be discharged within the next day or 2. With regards to our step-down, 5 persons, all of those persons are at the UA Debe facility. And in terms of our quarantine, 349 persons spread amongst many facilities. So starting at the Chancellor Hotel, there are 5 persons. At Cascadia, 35. Regent Star, 55. Paria Suites, 27. Debe Halls, 40. Cara Suites, 37. Cape Park Hotel, 79. Napa, 19. Homer Football, 20. Trade Winds Hotel, 30. And Southern Medical, 2 persons at this time. With regards to... So we go straight into our presentation, which will basically tell you where the remaining active cases are distributed in the country. So if I can have my first slide. So this is just gives you a rough idea of by county. So we have different colors depicting the counties, starting on the St. George in St. George West, which is the northwest of the country. There's 1 active case at this point in time in home isolation. So these are cases in home isolation. St. George Central right next to it, going a little bit to the east, 4 persons. St. George East, there are 6. St. Andrew, St. David, 2 persons. We're going down to the River Mayaro. There's no one in that county that is active at this point. No one in Tobago as well in terms of active cases. St. Patrick, we have 8 persons. And then the bulk of the cases in terms of active cases are really housed between County Caroni and County Victoria, where we have 28 and 26 respectively. Next slide. So again, just gives you in a different format a pie chart, so we can see some percentages as to what percentage each country contributes to the active case load. And again, starting in St. George West, 1.3%, St. George Central, 5.3%, St. George East, 8.0%, St. Andrew, St. David, 2.7%, Caroni, 37.3%, St. Patrick, 10.7%, Victoria, 34.7%. So again, in another format, we see that County Caroni as well as County Victoria contribute the major share of the active cases at this point in time. Next slide. So home isolation, clinical disposition, we have had 5.7% of those recovering, Transferred to facilities, 10.2%, mostly to step-down facilities, as well as Couva Hospital. Symptomatic cases are 23.9% of the entire amount, and asymptomatic persons account for 60.2%. Next slide. Again, those with comorbidities. Comorbidities being illnesses, for example, diabetes, hypertension, asthma, cardiovascular disease. So the darker color blue, with comorbidity, accounting for 60.8%, and those without comorbidities, 39.2%. Next slide. Again, a little further detail onto the actual comorbidities that we're seeing. So diabetes, again, the 26.5% being the largest proportion. Hypertension, 20.6%. Heart disease or cerebral or cardiovascular disease, 8.8%. Immune deficiency, 5.9%. Asthma, 17.6%. Other, 17.6%. And we have pregnant patients, not that it is a comorbid state, but it is a state that persons may be prone to increased risk of complications of COVID-19, 2.9%. Next slide will show us some distribution by age, and we go again from the left to the right. 12.78% of those 0 to 19 years of age. In terms of our largest cohort, has been throughout the pandemic between 20 and 59, if you add those two figures together. Separately, 20 to 39 accounts for 32.33%, 40 to 59, 29.32%, and 60 to 79 at 24.44%. Those 80 plus, 1.13%, but has accounted for, and I think Dr. Hines will go into detail, a large proportion of our deaths that we have seen so far. Next slide. So patient distribution by sex. This is my last slide, just to say that we have throughout the pandemic been almost equivalent by male to female ratio in terms of infections, and we now stand at females being 52.7%, males 47.3%, no significant deviation in that regard. So Mr. Alcantara, that brings me to the end of my clinical update for this morning.
Thank you very much, CMO. And we go now to Dr. Hines, who will give us the epidemiological update as it relates to COVID-19 in Trinidad and Tobago.
Thank you, Ms. Alcantara. Good morning to the CMO, good morning to Dr. Inder, morning to members of the media and members of the viewing and listening public. The epidemiologic update for today is as follows. May I have the first slide, please? Looking at the data as it stood at yesterday at 4 p.m., next slide, please. We can see that the downward trend in that epidemic curve has continued. If we look all the way to the right-hand end of that graph, we see that the bars that are in orange representing the first few days of March are shorter, lower than the ones in February, lower than those in January, and it basically is demonstrating that downward trend that you're seeing in the daily numbers, with our 7-day rolling average currently standing around 3 cases per day. Again, just to remind the population that even with that 7-day rolling average of 3 cases per day, we have accumulated in excess of 560 cases for the year thus far. So it doesn't mean that the virus has disappeared, but it does mean that our current levels or rates of transmission are relatively low. Next slide, please. As we see, with the bulk of the cases that would have accrued over the time period, we are seeing that division between males and females, males on the left in blue, females on the right in pink in the pyramid. And we see that the males account for about 53% of the total, as opposed to the females, who would make up the next 47%, and that the age group 25 to 49, to echo what the CMO said, really makes up the majority. That age group alone makes up more than half, 55.2% of the total cases that we would have seen over that time frame. Next slide, please. In contrast, however, we note that among the COVID-19 fatalities, the men outnumber the women nearly 3 to 1, so that about 74% of the deaths have been among men. And more than 66% of the deaths have been in that over 60 age group. There have been deaths in the younger age groups, And the important message is really that no one is guaranteed or no one is immune from death, but the higher risk does tend to manifest itself in those higher age groups, and it is also associated with the presence of other diseases, largely the chronic diseases, the heart disease, diabetes, hypertension, kidney disease, sometimes treatment from cancers. Those sorts of things have been seen more frequently among those who have passed on. So we do just want to continue to encourage all persons to take note of the measures to prevent yourself from getting ill, especially if you know that you are in the group of individuals in the country that has one or more comorbidities. Next slide, please. Looking at the distribution of new cases over the past 2 epidemiologic weeks, we are seeing basically exactly what's reflected in the CMO's charts and map from his presentation, where most of the action, so to speak, is currently being seen in County Caroni, County Victoria. We're seeing sort of the tail end of the information that would have been coming out of Tobago. So the highlighted counties in the colors that you're seeing really represent smaller numbers than previously, with the highest number, I think, being 5 cases in the community, with the most cases in that 2-week period. But the important thing is that in spite of this, we do want to continue to encourage the cooperation that the population is expected to display with the contact tracing. We're seeing that the contact tracing, linking out from the cases that have been identified, ensuring that those individuals do not go out into the population and continue to spread virus, that robust activity that has been taking place in each county has resulted in the low numbers that we're seeing now, manifested in the low numbers of new cases per day, low numbers of new cases per community, and also in the low occupancy in the hospitals at this point in time. So we do know that that important contact tracing activity continues to be robust and continues to be successful in ensuring that people don't pass illness on to others once they have been diagnosed. If you have not been diagnosed and you happen to be asymptomatically ill, then the important behaviors that will help you not to share illness would be the continuing of the public health measures that we've been continuing to enforce and to ask people to remember, that mask wearing, that physical distancing, that hand sanitization and general hygiene. Those things, even if you don't know that you are ill because you're asymptomatically infected, those things reduce your risk of spreading illness to other people. So that those 2 layers of activity by themselves are helping to reduce greatly that risk of transmission of illness at this point in time, and we're seeing the success of that with the lower numbers that we've been seeing over the past few weeks, and with the lower levels of hospitalization in general. So with that, I'd like to conclude the epidemiologic update and turn you back over to Ms. Alcantara.
Thank you very much. And so Dr. Hines and Dr. Parasram gave us the perspective from Trinidad and Tobago. And now we go to Dr. Indar from CARPHA, who will give us the regional perspective on COVID-19.
Thank you very much, Candice. Next slide. Let me thank Ministry of Health for inviting CARPHA to be part of this press conference to give the regional update. Next slide. Next slide. So CARPHA is the regional public health agency, and we're really mandated by our heads of government to really, when it comes to emergency, a public health emergency, to lead. So to provide the necessary technical support for our member states. And we are doing this from many different levels. At the highest level, we are really helping at the regional coordination, where we work with our prime ministers, our ministers of health, our chief medical officers. We have a regional coordinating mechanism for health security. And we have also activated our incident management team so that we can provide around-the-clock support for our member states in terms of, providing the best possible information for response. Our other role is in laboratory direct testing, as well as validation of test kits, We provide information with our multiple different sectors. One of them is the tourism sector, where we have created a tourism task force with our Caribbean Hotel Association as well as our Caribbean Tourism Association, so that we can have harmonized measures for reopening. We provide information on the variants, on the vaccines in terms of updates. We provide a range of detailed epidemiological information, and twice per week on a Monday and a Tuesday, we produce a situation report that gives you a good idea what's happening in our countries, our numbers, our rates, our types of transmission. So I urge you to go onto our website and get that information. In terms of other support, we help in terms of providing information for vaccination, procurement, communication, and a lot of messaging in terms of safe measures for COVID. Next slide. So what is the data showing from a global level? Well, the data shows, that as of March 9th, which was yesterday, over 117 million cases, and that continues. Of them, the active cases are over 21 million cases. Next slide. And of course, this are in 221 countries. This shows you the different areas in the world, and really, North America is leading in terms of numbers. Next slide. So how do we convert that to what's happening in the Caribbean? So even though there are 117 million cases, in the Caribbean, among 35 countries and territories that report, it's about 545,000 reported cases, and this is in our situation report as of Monday, 8th of March, and there were about 7,000 plus deaths, particularly for our CARPHA member states, which is a subset of those Caribbean countries. Among our 24 countries, our numbers are much, much lower, 114,000 cases. And this is where I want to pause for a minute to say, our member states and the Caribbean is doing so well compared to the rest of the world because of many different stringent measures that were taken very early o'clock. Very early in the pandemic, we closed our borders, and then we implemented, public health measures of masking and social distancing and, hand hygiene. And we continue to do so. And even as borders are opening in different countries, they continue to enforce strict measures, public health measures. And this is why a big reason why our numbers are so low and continue to be so low compared to what's happening in the rest of the world. Next slide. So I want to really end with this. For us, the pandemic, the numbers are high. You are seeing globally what is happening in terms of rates of infection. If you compare the rates of infection for the Caribbean compared to the US and the UK, it's a whole big difference. And that's because of the measures that we have been taken in terms of prevention of COVID. So COVID, as we know, is a viral disease transmitted from person to person through those respiratory droplets. So we need to take the measures, and Trinidad and Tobago has the 3 W's, maintaining your distance and washing your hands and wearing your mask. We want to add, keep maintaining that social distance. The science says at least 6 feet. So at least means it can't be 1 feet, at least 6 feet. You want to ensure that you're washing your hands. And there's a lot of infographics on CARPHA as well as the Ministry of Health website on how you wash your hands. It's not a simple thing of just washing your hands. You need to use your soap and you need to use your sanitizer afterwards. Wear your face mask. That's really, really important because the masks prevent you from possibly contaminating others and prevent others from contaminating you. And if you wear your face mask, you would avoid touching your eyes and your face and your nose. So that's a big, big, big difference in terms of wearing your face mask in terms of a protection for you. If you do have to cough and sneeze, we ask you to, if you don't have a disposable napkin, cough and sneeze into your elbow. And if you are sick, stay at home. We cannot overemphasize the importance of staying at home. And avoid the gatherings. this is not just a Trini thing, but it's a Caribbean thing. We love to have crowds and parties, and we know even down with our closed borders, we have a lot of house parties, and we are asking you to avoid the gatherings and avoid that close contact, because this is what is causing the spread. We know vaccines are coming out. There is a lot of information out there. As we get more information about transmission, and we are able to be able to prove that vaccines, are going to definitely prevent transmission. Right now, the most important thing is to continue our public health measures. Thank you very much.
Thank you, Dr. Indar, for that update on COVID-19, but from the Caribbean point of view. And as is customary, the next portion of today's media conference will be devoted to questions and answers from the media. We ask our media representatives, please state your name and the media house that you represent, and please no more than 2 brief questions at this time, and if we have additional questions, we will come back to you. We begin this morning with questions from 98.1.
Good morning again to you, Ms. Candice Alcantara, and members of the panel. Stephen Cummings here, 98.1 FM. I have 2 brief, quick questions for Dr. Parasaram. May have an element of, of a policy, position nature, but I'm still hoping that you can respond to it. Dr. Parasaram, I noted with interest a call by the Tobago Business Chamber for a special batch of vaccines to be made available to the island. What is the formula that is going to be used or be considered in this vaccine rollout for Tobago to ensure equity, albeit it's a smaller population? And I'm looking at what role would the THA and its Department of Health play, barring the politics, of course, now at the THA. And secondly, are there any other COVID-19 holding facilities being considered at the moment for regularization, a return to regular patient service? I've heard, the Arima Hospital, for example, has been one of those facilities that has been, returned to some sort of, normalcy. Are there any other facilities that that you can talk about, that we can see some sort of a return to regular service? Thank you.
Okay, so in terms of the first question with regards to Tobago, when we look at the COVAX allocation for the country, we are looking at Trinidad and Tobago. So in our first tranche of 20%, we will use similar formulas and apply them across the board for both Trinidad and Tobago. Of course, there will be collaboration with the THA at all stages, as well as my counterpart, Dr. Hoyt, to ensure that there's equity. And we will take into consideration the smaller size of the island and the way businesses transacted the movement in the island as well when we do the allocation eventually. But that will have to be a discussion between the THA and the Ministry of Health as well before we can make a determination of an actual amount. With regards to similar facilities like Arima, the main COVID hospitals at this point are Couva, continue to be Couva, Cora, Augustus Long to the most part. Cora has continued to maintain its function as a tuberculosis thoracic facility throughout COVID-19, and that continues to be the case. Maybe a month or 2 ago, we would have taken the decision to try to get the majority of cases into the Couva facility as opposed to Cora. Cora being retained for certain special groups, for example, those with concomitant infection of TB and COVID-19 would go to Cora, and other special groups. So Cora has been functioning. We look at the Scarborough General Hospital continues to function. They have different areas in their parallel system that they have earmarked for COVID-19, but to the most part, Arima going back as a full hospital is the only one in that scale at this point in time. And as the epidemic progresses and vaccines are delivered, then we make some decisions further on.
Thank you very much. We go now to questions from Newsday, please.
Hi, good morning. Paula Lindo here from the Newsday. I wanted to find out from the CMO, have people been taking their children to get yellow fever vaccines after the last call that was put out? Sure. And are people in affected areas getting vaccinated? And my second question is there any thought of allowing more organized sporting leagues to resume since our numbers are low? Thank you.
Sorry, Ms.
Can you
Lindo,
repeat
could
the
you
second
repeat the
question,
second
please?
question, please? Yeah, just
Just the
repeat the
second
second
question.
question. We need to have the mic unmuted so
Yes,
that
sorry.
there you go.
It was. Right, very good. So the second question, is there any thought of allowing more organized sporting leagues to resume since our numbers are so low?
Right, organized sporting leagues, yes? Is that what you said?
Sporting.
Yes.
Okay,
Yes.
all right.
Yes.
All right, okay. So the first question, as we said when we raised the issue of yellow fever a couple of weeks ago, we would have said to the population that we had a coverage rate of about, I think it was 89.2% for the entire country. At a national level, we had made a call to all the CMHs. I would have met with all of them formally as well, including Tobago, to put strategies in place so that we can get that number up as quickly as possible. And what they did is they actually pulled the notes of those individuals that would have not had their vaccine during the 2020 period, and they were able to successfully, within about 2 weeks, get that number from 89.2% to 90.4%, which accounts for about 192 people across the system. The total amount of persons that they have to get to remaining will be about 800 to 900 persons in terms of the actual number of individuals that need to get that number back up. And that would be up to 100%, not up to 95% necessarily, which is what WHO recommends. With regards to sporting, again, as the numbers we will continue to make our recommendations from time to time based on the numbers, based on the occupancy, to the Honorable Prime Minister and the Honorable Minister of Health, and then ultimately the decisions will lie with them in the coming weeks. I'm sure we will review certain aspects of what is still being viewed as closed in terms of sectors, and then we will make our recommendations as per usual, but nothing concrete has been made with regards to that particular aspect you noted.
Thank you, CMO, and we continue to encourage persons to review your own documentation and ensure that you and your loved ones are sufficiently vaccinated against COVID-19. We go to, against the yellow fever, my apologies. We go to TTT, please.
Good morning, everyone. Crystal Wilson, TTT Limited. According to the clinical update, COVID-19 positive cases are significantly low. My question is whether or not this is reflective of the number of persons being tested daily for the virus. Thank you.
Yeah, so basically it has been, our protocol has remained the same throughout the epidemic, in the sense that we are testing persons that present to our facilities with symptoms of any sort. And we had also given some discretion to the CMOHs to test primary contacts of known cases, although they had no symptoms as well. So those two large groups would have formed the backbone of what we would have been testing throughout the epidemic. If you notice, when we would have had increase in number of cases in August and September, we would have had an increase in number of tests conducted as well. And as a function of the increase in viral illness in the population as well. So the pattern of testing continues in alignment with what we are seeing presenting to our facilities. I think in terms of the actual positivity rate, meaning the persons presented, the test completed, conducted over the actual positives that we're getting has gone down significantly in terms of, I would say 2 months ago, we would have been still hovering around 8% of those tested coming back positive. Over the last 2 or 3 weeks, that has gone down significantly to less than 2 to 3% in terms of our positivity rate, meaning that of those tested, there are very low levels of positivity coming back to us. Even yesterday, I would have had a meeting with the chiefs of staff, and from the eastern region, they have noted the SARI cases, which is severe acute respiratory illness type patients. They would have tested 20 persons over a 24 to 48 hour period in eastern RHA. And of all those severe respiratory illnesses that presented, none of them came back as positive. So the strategy remains the same, which is aligned to WHO's testing strategy. And is it that you want some clarification on it, Ms. Wilson? So yeah, so our strategy remains the same, more or less, from the beginning to now. And the numbers of persons presenting are really indicative of who is being infected or who has viral illness in the population. And of course, a proportion of those will be COVID-19.
All right, thank you.
Yeah.
Thank you very much. And we go now to Wired 868, please.
Good morning, everyone.
Good morning.
Can you hear me?
Yeah.
We can. Good morning. Please go ahead and pose your questions. We can hear you.
Yes, you're hearing me. Okay,
Yes.
great. My question follows up on Ms. Wilson's question. I'm wondering, since the testing protocol has remained the same, I'm wondering now that numbers are low and that we are likely going to have to wait some time before we get the vaccination started on the mass population, whether or not there's going to be any move to increase testing, either by a survey in terms of just community random samplings or through contact tracing asymptomatic patients to get an idea of what the level of virus is in circulation from asymptomatic people. That's my first question. My question for Dr. Indar is whether she's noticed in the Caribbean some strategies that have helped other islands with their borders open keep their numbers low. So what strategies have we seen in the other islands whose borders have not been closed to keep their transmission levels low?
So yeah, I think the testing strategy that we have has been working successfully throughout the epidemic. What we had done at certain stages is widen the actual testing of persons who are primary, secondary, tertiary contacts, and maybe again with the discretion of the CMOH, they have that discretion that they can actually test asymptomatic people who they think are significant contacts of a known case. So they have that discretion, and I have had that discussion with them. So if need be to widen that testing into primary, secondary, and tertiary, they can do so. And they have been doing so. Actually in Tobago, they cast an extremely wide net. And I had a long discussion with Dr. Hoyt about it this morning. The way she continued to test persons that were in the affected school and then in the affected home, they went to primary and secondary and tertiary contacts, asymptomatic all. So they have that discretion and they continue to utilize that as they see fit, especially with the low numbers. We can widen it a little bit because we want to catch all possible cases so we can get that number staying as low as we can for as long as we possibly can.
So with respect to what strategies that the other islands are doing and what has worked, well, let me start by saying, it has been a mixed bag for the countries that have opened. You have seen increases and some you have not seen increases in. Generally, what has worked based on, when we compare the curves and the numbers, is that stringent measures, asking for a COVID negative test, screening when a person is traveling if they have been in contact with a COVID person who was positive before, and when they do come in, adherence to wearing masks and having staying apart, social distancing, proper hand hygiene, avoiding contact, and so on, in terms of crowding. So that has worked, and it will continue to work, not just for the visitors, but what we have noticed in countries where it has worked well is where the population is also carrying that out. So not just the travelers, but the population. What we have been seeing as borders open, we have seen sometimes also increase in community spread. And that increase in community spread is occurring among the community because of community action. And, so sometimes there is a bit of disparity indicating where you may say borders have opened and the numbers have increased. But it has to be a joint effort among the community to keep doing these measures, the public health measures, while the government continues their testing, their contact tracing, and their stringent measures for entry into the country.
Thank you very much. And now questions from AZP News, please.
Hi, good morning. Priya Bihari, AZPnews.com. I think that Fiola and Crystal sort of preempted my question, but I just wanted to put it in perspective in the sense that the last two updates from the Ministry of Health, it dealt with samples that was done from between March 5th and 8th, and I think that would have been just close to 1,700 samples taken, and there have been no positive cases. Is that therefore an argument that could be made for us to have, some rollback measures there, given the number of samples and no positive cases? And my second question, maybe Dr. Hines. Dr. Hines, when we start to give out the vaccines, do you have an idea of the rate per day? I mean, how many people would be vaccinated per day when it really gets going? Thank you.
So again, I mean, I think Minister would have addressed the issue at length on Monday's press conference. I don't want to go too much into it. In terms of rollback, I mean, it is similar to the question related to sports. We have to view all of it in context, and we will continue to make the recommendations as need be. But ultimately, the Minister of Health and the Honourable Prime Minister would make those decisions as it relates to rollback of any public health measures. With regards to your second question, we can't give you a rate of vaccination. It depends on a lot of factors. It depends on the uptake from the population, most importantly. When we do have the vaccines, how quickly persons are willing to accept the vaccine. And we are hoping that a large number of people will come to us very quickly when we do offer the vaccine, and that will get our rate up but we have no target in terms of a rate that we are looking for of the population. As we said before, we're looking at two phases, more or less. We're looking to protect the vulnerable population as quickly as we can, and those are the healthcare workers, the persons over 60, and those with NCDs. So that entire group, we need to protect them very quickly to prevent any onwards severe reactions, severe complications, or death from COVID-19. And then, of course, we do the general population thereafter to achieve herd immunity in the population.
Thank you very much. And we go now to TV6, please, for questions.
Hi, good morning. Alicia Boucher from TV6 here. The first question, Dr. Parasram, I've noted how well home isolation or persons in home isolation has been going. It has helped to keep, our numbers in the health system very, very low in terms of in the hospitals. However, when it comes to state quarantine facilities for repatriated nationals, those remain at optimal levels, almost full. And given that repatriation is pegged onto the space that we have in those facilities, I was wondering, would there be any clinical or medical challenges in terms of having repatriated nationals in home isolation, especially even given that we are requiring them to have a negative PCR test at least 72 hours before they come into the country? So that's my first question. Second question is for Dr. Indar. Dr. Indar, can you give us an idea of what the variant strains are looking like in terms of the regional aspect, if we do have it in the region, and what those levels are looking like?
Okay, so just to be clear, so our policy remains the same. So for low-risk countries, those countries that categorize as no spread or sporadic spread by WHO, persons can have a negative PCR and can go home for 14 days and do home quarantine for 14 days. Those are from low-risk countries. From high-risk countries, those are countries which have cluster spread or community spread. Persons are required to stay in state quarantine for 7 days and then followed by home quarantine for additional 7 days. So there's a state quarantine period for 7 days and a home quarantine period, the exception being those coming directly from UK or leaving UK within 14 days. Those individuals have to spend 14 days in a state facility. The rationale for it has always been the possibility of variants, and Dr. Indar will go into the details in the region after. We are concerned about the variants more so than ever because we have seen that they impact both vaccine efficacy and they also impact the spread of disease. Some of the strains are much more transmissible. They spread from one person to the next much more easily, and they have been confirmation to some extent that some of the strains actually produce increased morbidity and mortality, so meaning more severe illness. So with those concerns, we maintain our policies for now to ensure that none of the strains come into Trinidad, especially as we lead up to vaccination. You don't want a new strain coming in, and it affects the way the effectiveness of the vaccine ultimately behaves in Trinidad and Tobago. We won't have the effectiveness that we want. So we want to keep those other strains out as best as we can. By way of an update for Trinidad perspective first, we would have had 150 samples taken so far. two variants detected. There would have been the B117 out of, which is a UK variant, which we had in a repatriated person. We continue to have cases of repatriated persons being positive, even with your negative PCR 72 hours in advance. We have actually had a case of the variant from Brazil. However, that person was actually aboard a vessel, did not disembark the vessel, ultimately left Trinidad's waters and recovered on the ship, so wasn't allowed to come into Trinidad and Tobago at all. That was another variant that was picked up fairly recently. So Dr. Indar can go into the regional perspective.
Yes, so thanks for that question. And as CMO said, the issue of the variants is one of the reasons we want to continue to be vigilant and continue to, to wear our mask and to have proper hand hygiene and to keep apart, because the variants, which is a mutation of the vaccines, and that's normal. Viruses tend to mutate. But what we have been seeing with the variants is that, the ones that we have seen, they all have shown to be more highly transmissible, and some of them, like the South African variant, has shown to have a higher case fatality rate. So, the literature shows that there are about 4,000 variants. Just one change, it's like a link in a chain. One difference makes a change or a mutation. It's called a variant. But the three that are most important are the UK variant, the South African, and the Brazil. We have been working with the University of the West Indies for gene sequencing, and in doing so, we test for all the variants, a variation from the COVID-19 gene sequence, and we have seen the UK, and as the CMO said, there has been, one particular case that did not come out. We have seen also a possible mutation in one country from another, similar to, but not the Brazil variant. But what the message with the variants here is that, we have to be more vigilant. Once there is travel, there's a possibility of introducing the variants, because we know that, for instance, the UK variant, over 40 or 50% of that of the cases in the UK are due to the UK variant. So we want to make sure that, while even though our numbers are low, for instance, in Trinidad and in some Caribbean countries that they're reducing, we want to be vigilant, and until we can prove that vaccines can fully stop transmission, we have to continue to be vigilant, especially now in light of these variants being more highly transmissible and some of them being more, has a higher case fatality rate.
Thank you, CMO and Dr. Indar. We go to a follow-up question from Wired 868, please.
Hi, good morning again. My question is with relation to the schools, the children who have returned to schools. They've been back in school now for a little over a month, and I'm wondering what we've seen, if we've seen any trends that could signal maybe that we'll start introducing more classes or anything like that.
Thank you. Oh, CMO, go ahead.
Yeah. So what we have seen, I know we had a positive case linked to Tobago that everyone is familiar with. That's the only positive case we actually had within the school system during the past couple of months. So it means a couple of things. One, the numbers that we are seeing, the viral level in the country with regards to COVID-19 seems to be sufficiently low that we are able to maintain that sort of scenario happening, and that the public health measures that are in place in the schools have been, to the most part, adhered to in terms of mask wearing and all the other measures that have been put in place. So I think it's a successful reopening of that particular phase of schools. Again, we will take it one stage at a time, make our recommendations to the Honorable Prime Minister, and then ultimately that decision lies with himself and the Minister of Education with regards to how we proceed forward. But we will continue to provide our advice from a health perspective.
Thank you very much. And now to TTT Limited, please.
Hello again. Just hoping for an update. Have we been updated at all from the police or national security concerning how members of the public are adhering to face mask wearing? And what about congregating outside of bars? Thank you.
No, I haven't had any formal update from national security in that regard. I do have a member of the police force on my interministerial task force, and I can reach out to him as well to get some sort of update.
Thank you. Now to Newsday, please, for a follow-up question.
Hi, good day again. I wanted to know if there has been any thought to appeals by turtle conservationists to allow them to access beaches at night now that turtle nesting season is in full swing?
Yeah, so I think that matter was also dealt with by the Honorable Minister on Monday's press conference, so there has been no change as far as I know in that regard.
Thank you very much. And we seem to have come to the end of questions this morning. Just checking one last time if any members of the media have any questions for our panelists. We have with us the CMO, we have Dr. Hines and Dr. Lisa Indar from CARPHA. And yes, so it seems we have come to the end of today's media conference. Thank you everyone for joining us. Today we were given both a domestic and a regional perspective on the COVID-19 response. And we were reminded that the control of COVID-19 really is a dual responsibility between the communities, what happens with our everyday lives, and of course the measures implemented by the state. So please continue to follow the 3 W's. Most importantly, of course, wear your mask and be safe.
Hello, welcome to Science in 5. I'm Pascal Antoni, and this is WHO's Conversations in Science. Today we'll be speaking about the evolution of the SARS-CoV-2 virus, which is the virus that causes COVID-19. Here to answer our questions is WHO's Dr. Maria Van Kerkhove. Welcome back to the show, Maria.
Thanks for having me.
Maria, what is the latest information on the SARS-CoV-2 variants?
WHO with partners are currently tracking 3 virus variants of concern that are circulating around the world. The first is the B.1.1.7 that was first identified in the United Kingdom. The second is the B.1.351 that was first identified in South Africa. And the third is the P.1, which was it's circulating in Brazil, but it was identified among travelers arriving in Japan. We are tracking changes in the virus and what this means in terms of transmission, severity, and impact or potential impact on diagnostics, therapeutics, and vaccines. So far, the information that we have is that there is increased transmissibility in the B.1.1.7 and the B.1.351 virus variants. And this is resulting from a mutation that allows this virus variant to bind to the cell, the human cell, more easily. We do not see an increase yet in transmission with the P1, but that is currently under investigation. In terms of severity, there are some studies from the United Kingdom that suggest that the B.1.1.7 has increased severity. There are studies that are underway that are evaluating the effect of vaccines against these virus variants. And from the information that we have so far, the vaccines still work against these virus variants.
Maria, how is WHO tracking virus mutations globally, and how do we know which ones are important?
So WHO is tracking different mutations and variants around the world through genomic sequencing. We are working with our member states and with partners around the world to increase sequencing capacity around the world so that we can identify any changes in the virus over time. This is natural virus evolution, and many countries around the world have actually been sequencing viruses from the beginning of this pandemic. We are working to increase the ability to do sequencing around the world so that we can see in all countries where changes are being detected and where variants of interest are being detected. The variants that are important are ones that have changes in the way that the virus behave. Either they may have increased transmissibility, they may cause more severe disease, or they may have some kind of impact on the workings of our diagnostics, our therapeutics, and vaccines. If any of the variants have any of those changes, those are variants of concern. And we need to make sure that we study those appropriately and that any changes that are needed in our public health and social measures or in the way that we develop our diagnostics or the vaccine composition are informed by our understanding of what those changes are.
Maria, what can people do to protect themselves against the SARS-CoV-2 variants?
There's so much that you can do to protect yourself against the SARS-CoV-2 virus, including the variants that have been reported. It's all about the individual level measures. physical distancing, hand hygiene, wearing a mask, respiratory etiquette, opening a window, avoiding crowded spaces, staying home if you're unwell, making sure you get tested if needed, following the local advice where you live. We have seen in a number of countries where these virus variants are circulating that transmission is being reduced with the use of these measures. And this is really critical. We have had many global consultations and meetings to look at these virus variants and determine if any changes are needed in our guidance. And so far, with all of the information that we have, the public health and social measures, the infection prevention and control measures in healthcare facilities and outside of healthcare facilities work against these virus variants. Take all of the steps that you can to keep yourself and your loved ones safe against SARS-CoV-2.
Thank you, Maria. That was WHO's Dr. Maria Van Kerkhove explaining the evolution of the SARS-CoV-2 virus. Please share this information with your networks, and we'll update you as more comes in. Until next time then, stay safe, stay healthy, and stick with science.
Well, I'm going to get some bacon shark.
Oh, all right.
Yeah, my boy, yeah.
Just remember, it's still a COVID out there. Beach or no beach? Yeah. Hey, you wash your hands? And where's your mask? You know what? 10 things to remember when you're by the beach. If you're sick, stay home. Wear a mask. Oh, social distance, remember, 6 feet. Avoid large crowds. Yes. Oh, remember, don't socialize with people you don't live with. When you're going to buy your food by the food vendors, make sure that they have the badge, the mask on, and the gloves. Oh, and make sure that they have somewhere that you can wash your hands and sanitize. Do not be sharing beach toys with people you don't live with, all right? Like your beach balls and your frisbees. Stop it. And when you go to buy your little bacon sharks, take it and go outside and eat. Do not eat it in the enclosed areas. Oh, and the final and last thing, enjoy yourself. Yes, enjoy.
Thank you, Granny. Shake your body, Lord. Oh, yeah. People, this is serious business. You need to sanitize. Please walk with your sanitizer in your purse. You might be walking the road and there's no soap and there's no water. What you could use your sanitizer. Make sure your sanitizer is over 60% alcohol base. Please, it could save lives. Save the senior citizens, Granny. Let me show them. Please, put in your hand. Use the sanitizer. Rub it all over the hand. Between the fingers, get in there. Use it, and the fingernails. Make sure under the fingernails too, get in there. And the thumbs and inside of the palms. Rub it, the wrist, everything. Rub it. It is important, people. This is to save lives. The senior citizen asking all you, stop putting us at risk. Save lives, be wise, and sanitize. I don't know what's wrong with Gladys, you know. I don't know. She's jumping up and down and carrying on like she's a crapo, like a carnival. She said this because of the hand sanitizer, because it's 60% alcohol based, and then have she carrying on so. And that is the only good sanitizer it ever. It had to be over 60%. Hello, people. It is important. Be wise and sanitize. You're walking the road.